Hello and welcome to this special edition of FIU Insights, how local journalists are covering the crisis and how the pandemic is impacting newsrooms. I'm David J. Kramer with the Stephen J. Green School of International and Public Affairs, and I'm glad that you could join us for this collaborative effort between FIU and the Miami Herald. Joining us today from the Herald are Mindy Marquez, President and Publisher and Executive Editor of the Herald, Nancy San Martin, Managing Editor of El Nuevo Herald, Ben Konark, health writer with the Miami Herald. Last but not least is Jane Wooldridge, business editor at the Herald. Thrilled to have all of you with us here today for this special edition. COVID-19 pandemic poses challenges and difficulties for all of us. We rely on media for facts and information. Local journalism has proven to be more important than ever. Miami Herald offers its readers international, national, state and local news, and many of us have turned to it to learn what's going on in our community and beyond. So if I can, Mindy, let me start with you with a broad question about how this pandemic and crisis have underscored the importance of journalism broadly and local journalism in particular.
Thank you so much, David. I appreciate you doing this. We always say that the things that impact people the most and sometimes get the least amount of attention are the things that happen at the local and state level, right? Sometimes national politics are more entertaining, but in reality, the decisions that are going to impact your day-to-day lives, generally speaking, are happening locally. And nothing has really shown a light on that like this pandemic. We, of course, have been around for 116 years, and we have covered many a crisis, from the devastation of Hurricane Andrew to the deadly earthquake in Haiti to yearly threatening approaches by hurricanes. And so we know how to cover breaking news. This is different. This feels very different than anything we've done before, because number one, I think that is testing our ability to actually report in the ways that we're accustomed to. We ourselves are having to be very careful. We want our staff to be very careful. They can't get close to the story, which is what we normally do. We go right into the story. And also, you can't rely on national media to get what you need. You're not going to get what you need about, who's impacted locally, what's open, what's closing, what precautions you can take, where can you, what hours is a supermarket open? You're not going to get that from a national, from national media. And we are working literally around the clock to provide that to our readers right now.
And Nancy, if I can turn to you, could you maybe describe how you have, as managing editor of El Nuevo, how you have handled this in terms of allocation of reporters? What percentage of reporters are working on this story? There's obviously other news happening, though this is the dominant story.
Well, what's actually the reality right now for both Miami Herald and El Nuevo Herald is that we function as one big bilingual newsroom. So we share resources and we're sharing reporters. In fact, a couple of my reporters are working directly with Jane on the business beats that we've carved out specifically for this pandemic. It's all hands on deck, and that includes the sports reporters for both the Miami Herald and El Nuevo Herald. They too are pitching in on the coverage for the coronavirus.
And Ben, you're sort of on the beat from the health perspective of this. The numbers, sadly, are going up here, and see what's happening in New York and other places, New Orleans. Give us a sense right now on Monday of how you see this pandemic playing out in South Florida.
Yeah, I think there are still a lot of unknowns right now about how it's playing out. So we're all just kind of waiting to see how much the numbers go up and when they might start to flatten out. Testing plays a big role in this. We're seeing everything on a delay right now. So the numbers we have today are people who were infected 5 to 10, maybe even more than that days ago. So it's really hard to gauge kind of how quickly it's spreading here in Florida. So the best we can do is just put the numbers into context and tell people what we know about how testing works, how long it's taking, what the healthcare professionals are telling us, and just try to make the numbers make sense, because Florida's been doing an okay job of putting the numbers out there, but a lot of people don't really get the context behind the numbers. So that's been a big focus of ours, is to try to understand and try to help explain what these numbers actually mean.
And sticking with you, Ben, for a second, can you give us a sense of how hospitals are handling this so far, the level of capacity that they still have as the surge might continue?
Yeah, I mean, we're in a pretty fortunate position in Miami, specifically with hospital capacity. We have a lot of big hospitals here, and they're all working together and sharing information with each other about what their capacity is, how they're managing supply chains and things like that. We've reported on a couple empty facilities right now that these hospitals are eyeing as potential overflow capacity, whether that's for COVID-19 patients or patients who they have to redirect to other places, because, you know, Jackson Memorial may very well, unfortunately, become a COVID-19 kind of hospital, where they're talking, you know, Carlos Migoya, the CEO there, has mentioned that he has the ability to convert something like 75% of his rooms into rooms that would treat COVID patients. So we've done a bit of reporting on that. You know, Miami's in the fortunate position of having a really robust public hospital. And, you know, we've also reported that in 2013, county voters injected a lot more money into that hospital specifically for capital purchases. So, you know, we're in a better position than a lot of other places right now. But that's, you know, that doesn't mean we're out of the woods. There could be challenges down the road that would really make it very difficult to manage that flow of patients.
And Jane, turning to you from a business perspective, tourism obviously is a key industry down here. And you look at the restaurants and hotels, there's tremendous economic impact. If you can give us a sense of what you and your reporters are finding.
So we are following both the micro and the macro levels of this. Micro means hourly workers and white collar workers who have been laid off, who are struggling to figure out where their next meal is coming from. And some of the government relief programs are going to help them. One of the things we've been following are gig workers, freelancers of all sorts, who have not traditionally been included in these programs are being included this time. For us, that's really important because we have a large number of gig workers, freelancers. On the macro level, we're looking at issues, big picture issues like the unbanked. A lot of people here don't have traditional bank accounts for one reason or another. How are they getting by? Some of them are having to turn to very high interest loans. We are looking at the cruise industry down. It is an important player here. It has about 10,000 local workers. The airline industry is getting some support, so they are not going to be doing the same kind of actual layoffs. But we know in the tourism and hospitality area, every day I get a new number. One day it was 40% of workers would be laid off. The next week it was an estimate of 50% internationally would be laid off. Now it's higher. And in our community, where so many jobs are either directly or indirectly related to tourism, it's a much bigger hit than it is for some place that has a much more diversified economy.
In sticking with you, but also I want to bring in Ben on this. The cruise industry has also, there have been lots of stories written about people getting sick on these cruises, but then the question is, what do you do with them? So from a business perspective, if you could talk a little bit about the impact this is having specifically on the cruise industry. And then Ben, for you, there seems to be some reluctance to accept some of these large ships and what to do with some of the passengers who have tested positive. But Jane, starting with you.
Well, as I said, it's 10,000 local employees. Despite the fact that cruise lines are based off outside the U.S., those companies are, and therefore they don't pay direct U.S. income taxes. They pay for a lot of other things. For instance, in Miami-Dade County, last year they paid $77 million to the county in wharf fees. There are all of those ancillary impacts beyond the direct workers, but the florist who supplies cruise ships, the piano tuner, I mean, they're big and small, the food purveyors. So all of that has a pretty direct impact. Obviously, the cruise industry has had a number of really sick patients, and not just among the passengers, but also among crew. And so both of those scenarios are going to have long-term impacts on whether or not how comfortable people are with cruising into the future. Most of the lines have now announced that they're not going to be launching any cruises before some of them have moved as late as the end of May. And that's a question about what will this do long term to our economy. That does not diminish the human impact at all. The people who are sick on those ships, that's very real, and there have been a number of deaths, but there is this secondary impact that we will feel in this economy and in this community for months to come, if not years.
And so, Ben, absorbing from a health perspective, a lot of these passengers who aren't local to the community, but nevertheless, they are physically just off the shores here.
Yeah, I mean, I think right now we haven't seen a huge volume of that. There were some crew members who were escorted, I believe, yesterday. But I think it's a concern because what happens with this particular disease is that the ICU stays can be weeks long, anywhere from 2 weeks or more. So you can accept people under your current capacity, not understanding when that surge that we're anticipating might come. So I think that would be a concern for not just the local hospitals here, but the governor has expressed similar concerns. I also just want to say, on Jane's desk, on the business desk, Taylor Dolvin has been doing amazing reporting on the cruise ships. And I think it's a really good example of the strength of our newspaper, where we have a health reporter and we have someone who covers the cruises. So when this thing was really first starting to heat up, I had been watching it closely, and Taylor was right there to take ownership of the cruises. So I think me and her were kind of the first two reporters to get hit with this wave of coronavirus news. And it was this constant juggling act between the two of us. But I just think it's, not a lot of local newspapers have that ability to be flexible like that and to spread that coverage out. So I think it's really a strength of the Herald that we have someone who covers the cruise industry here who she's just been doing a great job staying on top of that.
Indeed, let me come back to you and ask you, we're talking about the economic impact. And before this crisis, many local newspapers were struggling financially, and the Herald's parent company, McClatchy, had declared bankruptcy before. How might this situation, this pandemic, affect the situation financially, economically for newspapers, for newsroom? Some of your businesses, for example, might be going out of business and not able to advertise as they perhaps had in the past.
I think that I have a colleague who said newspapers got coronavirus and they had underlying health conditions, right? So I think that is a really apt way to describe what this could do across the country at a time when local journalism is needed the most, right? Our business partners, they're literally their businesses, some of them literally overnight. And so we're not, right now, we are really committed to keep going but I'll have to tell you, we really need our audience to support us. I mean, one of the things that we've been doing in the last several years is really trying to diversify our revenue streams, right? So moving from a time when we really were solely dependent on advertising to a time when we're really looking at, yes, advertising is important, but audience revenue, which means the people who read us sustain us, not only in print, but also digitally. And that's something that we're really trying to move very quickly to. So we need the support of the people who are reading us. We're really working to be a lifeline right now to this community. And in order to keep doing that level of work, we do need the support. I mean, we're already seeing some local news organizations are having to make some very, very difficult decisions from, the local weeklies who really depended, I think, almost exclusively on the hardest hit segment of entertainment and restaurants, but even other dailies that are, incredibly powerful news organizations that are laying people off. We're not doing that. We've not laid off anybody in the newsroom. We don't have plans to lay off anybody in the newsroom. I said, our staff is really working virtually 24/7, all hands in.
And if I can, I think at the same time, if I'm right, you've also removed the paywall for articles related to the pandemic so that even non-subscribers can get access to the information that you provide. So you're in a way making your challenge even deeper.
That's true. And I think that where we were, given where we were when this started, I think it was absolutely the right thing to do. We've done it before. We do it during hurricanes, right? It's strategic. It's when we literally are in danger and you know, it's life-threatening. We do lift our paywall on those types of stories. And so we did lift our paywall. I think we're going to have to think about strategically moving forward, how do we balance you know, letting readers access absolutely life-threatening and essential information, while also hoping that some folks who have benefited from that would actually you know, click that subscribe button and support us in that way.
And Nancy, let me turn to you, and I know Jane and Ben also want to jump in too, but let me ask you about how you're juggling the assignments of reporters, because all of us, except I think Mindy's in the office, but the rest of us are working from home. How has that worked in terms of juggling assignments and getting the job done?
It actually worked out better than we anticipated when we initially, you know, made the tough decision to work remotely. It was tough, I think, more for the editors than it was for the reporters, because they're out in the field all the time. But it actually, technology has been our friend. I think it's forced us to kind of be more creative in terms of how we communicate and organize ourselves. And again, we've always been working as one newsroom, but now more than ever, because El Nuevo has less in terms of numbers. We are really double teaming on all the important stories, so that we have those crucial stories available in both languages. And then if a reporter is not writing in Spanish for our audience on a particular subject, we certainly have in-house translators that are picking up those stories, like the stories that Ben has written, and Taylor, and many of the other reporters in the newsroom. So we too are working 24/7. We're small, but we're feisty, and we are, you know, mano a mano with our Miami Herald colleagues, for sure.
And Jane, I think you wanted to jump in about the flexibility of Herald staff and how you've been handling that.
Well, I think one of the amazing stories that I can share is Michelle Kaufman, who usually writes about sports, has taken on a role in this crisis writing about tourism, because Taylor is pretty much 24/7 on cruises, and it's a bigger story. And Michelle is texting me while I'm sitting here. She's been in touch with somebody who is on a cruise ship, because she's helping with the cruise story today. She's sending me audio files from that interviewee so that we can share those with our readers. And one of the things that is really important is that all of our reporters really are pretty flexible people, and you can throw them at just about anything. And I think the value of training as basic journalism enables people to jump in on any story. We do that routinely at the Herald on the big stories. And if you don't have that basic journalism experience, that basic journalism training, you can't really do that. But most of our people do. And so regardless of their regular beats, a few of them aren't as savvy with data as some of the others are, but we have people to help them. Everybody else has been able to do an amazing range of stories. And so that combined effort really creates impact for our readers, because that's what this is about. It's creating impact for our readers.
Speaking of that, Ben, it's a perfect segue. Is, in the course of your reporting, what are you hearing from readers about the job that you and your colleagues at the Herald are doing?
Yeah, that's one of the brightest spots for reporters in a time like this. You know, we're all working hard. We're all very anxious like everyone else is. And it's hard to understate how much it means to a reporter when they hear from the readers on social media or in an email about how much they appreciate what we're doing. So the gratitude that we get from our readers really keeps us going. And it's just a reminder of how local journalism is really about community. It's about the ties we all have to Miami. It's about the work we're all doing together. We get tips from our readers. We share information with our readers, and our readers express their gratitude to us. So it's one of the bright spots over the last month and a half now of just getting that constant positive feedback and people really seeming to appreciate and value what we do.
Nancy, let me ask you about a different readership perhaps, and that is some of the sources for information that you rely on. Local officials, state officials. How would you describe the relationship that you and your reporters have had with those sources?
Well, it's both. I think for state, it's no secret it's been a little bit, what's the word? Problematic, for lack of a better term. And locally, I would say the relationships by and large are very good. We're getting, as much information as available. Some information is more accessible than others. The state information has been a bit frustrating, but we're doing the best that we can with what we've got, and we are finding information from other sources. If it's not from the direct funnel, then our reporters are out asking the right questions to the experts and whoever else may have the information that we need to get to our readers. I mean, we really are pushing the envelope on this, and we're doing it because we know that it is crucial information that our readers need, and that is our first and most important priority right now, is to get whatever information we can to give to our readers, because this is a very serious crisis that we're in.
And David, I just want to say, let's jump in and say, we're putting in records requests. We're pushing our public officials, no, it's not okay to say, hey, the past is the past. Let's not ruminate on what happened. Let's just move forward, because the past is a predictor of the future. And so, no, we do have to hold our elected officials accountable for what they are doing well, but also from what they're not doing well. And we do need answers. We have tons of questions. We still don't know the name of the ALF where that
assisted living facility.
Right, that has 2 deaths, and so if you had a parent in that facility, you would want to know that. And so that's among just one of many, many questions that we're trying to pursue. And we do need our readers too as partners. Like I said before, our ability to get into the middle of the story, like we would even in a hurricane, is completely been impacted. And so we have launched a tip line that's on our homepage where people can send us, and we are looking at those every day if they have tips about things or information that they think we should pursue. And we're also trying to bring the community together, which is another thing that I think we are connectors. We have launched a people to people effort, which tries to match people who can offer help with people who need it. And we're using organizations, social service organizations as intermediaries for that effort. So that also is on our homepage. So anybody, if you can do groceries for somebody, please visit that site and offer your services. If you need something, then please also go to that site. We're trying to build it up in partnership with local nonprofits.
And Mindy, over the weekend, there was a situation where one of your reporters was not allowed in for a briefing by the governor. Was that a misunderstanding? Has that situation been cleared up?
David, unfortunately, on Saturday, our bureau chief for the Tallahassee Bureau with the Tampa Bay Times, Marilyn Kloss, was denied access to a press conference held by Governor DeSantis. One of the reasons was that we had asked for social distancing for our reporters during these press conferences because they were in fact not observing the guidelines that the CDC had put out. It's interesting to note that while 6 of the news organizations around the state signed that letter, only one news organization was barred, and that was the Miami Herald and Tampa Bay Times. Also, unfortunately, came on the heels of a very tough editorial that our editorial board wrote, asking the governor to act with more urgency. So we have, of course, asked for our reporters to be given equal access. We are the actual epicenter of this crisis in Florida. To not allow the Miami Herald, the Nuevo Herald, also representing Bradenton Herald, and the Tampa Bay Times access to the governor to ask questions is really denying our readers and quite frankly the governor's constituents of critical information at this time.
Great. Ben, let me come to you from sort of the health beat perspective. You're reporting on a pandemic, a virus that, while it seems like it's been going on forever, is actually still fairly recent. We don't know a great deal about it. Can you describe the challenges in covering this?
Yeah, so I had actually been pretty new to healthcare reporting when this kind of first surfaced. Excuse me. So I've been covering, yeah, exactly. I've been covering healthcare for about 6 months. And then this thing came around. And interestingly, I was late January was when I was starting to pay attention, really before it had bubbled up in the kind of the national consciousness. And I was having conversations with my healthcare editor, Amy Driscoll, and with my colleague, Dan Chang, who was on the healthcare beat before me, and just kind of getting their thoughts and their institutional knowledge of what they thought, reading a lot of research, reading a lot from scientists and learning. And this was before we had any cases in the US. So I think, the Miami Herald's been through this before, even if it not quite to this scale, but we had Zika here. We had other public health crises here. And Amy and Dan, who I just mentioned, had a lot of experience with that. So I was constantly leaning on them even before this became a huge story. And we had a story that kind of, before the virus had really started spreading here, we had one local person who had flown to China, came back, thought he had coronavirus. Turned out he didn't, but he got stuck with a pretty big bill. And that story took off, and it was just kind of, the first kind of hint at what we might be facing here. So it was a really great experience to just have these people around me, my editor, my colleagues who've been through this before, so that even someone like me who's only been doing this for half a year, I never felt like I was really that steep on a learning curve, because no one knew anything about this virus. So I think that enabled us to jump on it really quickly. And I think the Herald's done a really good job of just, even before there were dozens, let alone hundreds of cases here, we were preparing people with vital information about when they should go to the hospital, when they should seek treatment, a focus on these kind of high utility stories that we thought our readers would benefit from. So I really think that's important. The way we view these public health crises is to really think about, what do our readers need to know? And that's been our focus from day one.
Great. We only have a couple minutes left. Jean, let me come to you, and then I'll go to Nancy and Mindy to wrap up. But the challenges of reporting on a situation like this, a crisis like this, but having to do so in many cases from your home, from your computer, rather than getting out as you ordinarily would to track down sources and be out there first-person accounts.
I think it is a challenge, and we're used to being able to send somebody around to the corner or whatever, or to the site of the story. So the tip line Mindy mentioned has been really important, but social media is also really important. And we have been able to touch base with people in many situations because of Facebook groups, or because we have put out Twitter requests. So I think that has helped us a lot. And of course, we're turning to the sources that we regularly turn to. I think it's really important to give a big shout out to our visual journalists, because they, by and large, are still out there. And it's one thing for me to conduct an interview or hold a staff meeting from my computer. It's something else. A visual journalist just can't do that. And so we are still sending them out. We have supplied them, as Mindy can tell you in spades, with lots of information about staying safe, a lot of tips, everything that we are able to provide them with. But I'm in awe of our visual journalists, because they're still out there on the streets. Some of our reporters are, like many of the people in our community, kind of sequestered because they have underlying health conditions, or it's just not safe for them to be out there. And our visual journalists really can't do their job any other way. So people need to know that, and that's a qualified risk, but a risk they're taking every day.
And Nancy, let me come to you as managing editor of El Nuevo. How do you strike that balance between doing the job of reporters and editors while also ensuring the health of you and your staff?
It's funny because I was having a conversation with a friend of mine this morning, and she said, it feels like the whole world is on timeout. And we actually did a timeout of our own when this first came out, and we were very forthright with the staff in terms of, what they needed to do to stay safe. But specifically, and I wanted to touch on the visual journalist component, we sat down and we, as a team, because I also oversee the visual department, and said, this is, how do we document this time in South Florida? At some point, hopefully in the near future, we're going to look back at this and say, remember that crazy time when coronavirus struck this community? How do we capture that as a moment in history? And that's what we're trying to do in terms of, beyond providing the essentials, the critical information, the utility stories, the where do you get X, Y, and Z. This is also a moment in history for our community, and we need to document that as best we can with words and with visuals. And that's why we continue to go out there because, that's the information that folks need, and this is a special time in our history that we need to document. So we give them the information that we need, and they are very well aware that if they're not comfortable in a situation, if they get to an assignment that does not feel safe, they have the authority to not move forward with that assignment.
Mindy, let me come to you for last words, and that is, the Miami Herald is a business, but it also serves a vital public service for the community. And so as you look ahead, the ability of the Herald to balance these things.
So I think that the silver lining in some ways is, I think that the essential nature of what we do has never been more evident than at this moment. The amount of readers who are coming to our website daily is really breaking all kinds of prior records that we've seen. So we know that we are providing a vital function, and I can tell you that our colleagues on the business side are trying to do everything they can to partner with our advertisers who have been hit by this, but also try to partner with the ones who are in a position to maybe help and figure out and be creative and what can we do together, because we're reaching so many people right now. I don't have a crystal ball, so I don't know what the future holds. I will tell you this, I've said it so many times, but I've never been prouder to be leading this organization. And the people who do work here every day, these journalists, the folks on our advertising side, the passion and dedication that they bring to this job is extraordinary, and their mission is to serve our community. They live here too. We're part of this community. What happens here impacts us, our families, our friends. And so I'm just incredibly proud of the journalism that's being produced by this organization right now in 2 languages, serving just wide swaths of our community. And so I am hopeful that with the continued support of our readers, who we are hearing from, I share those with the staff because I think those emails are amazing. Like, thank you, because I still got my paper and it's a part of my daily routine that I appreciate hasn't changed. I think that with the support of this community, we've rallied around other things in the past, and I think we'll come together again and we'll emerge hopefully stronger.
Great. Well, that's a great way to end. Let me, on behalf of my colleagues, thank the 4 of you, but also everyone else who works at the Herald, both the regular Herald and El Nuevo. for the terrific job you do under extraordinarily adverse circumstances. It really is a source that many of us have come to rely on. Mindy, Nancy, Jane, and Ben, sincere thanks for taking the time out of your very busy schedules while at the same time balancing things in your personal lives at home that none of us thought we would have to do under such circumstances. A special thanks to my dear friend Marielena Tarano, who is a member of the advisory board at the Green School at FIU, for her support in facilitating this conversation. Thanks to all of you for joining us, and many thanks to the Miami Herald for collaborating in this special FIU Insights. Thanks for joining us. See you next time.
Thank you.
Thank you.
Thank you.